Okay, then. So we'll start with introductions, shall we? Yeah, let's introduce ourselves. For those who have also recently just trained, welcome, Amy. I know you've just done your training on the 22nd of February. Am I right, Amy? You did your training this year?
No. I think my training's not till August, unfortunately.
Oh, by the way.
Yeah, so I did wonder if it's okay for me to be in today, or it's just because of the therapy groups and stuff I run, I can't do it until August, so I wasn't too sure.
No, that's absolutely fine. I've invited everyone who's waiting to be a champion as well to attend. So you are very welcome into this meeting so that you have an idea. It's just, forgive me, because I thought you were one of those who have just recently done their training. But yeah, if you want to introduce yourself, where you work, and if you want to tell us when you joined as a champion, because we've got like 3 cohorts. We've got champions who were there when I started. I think 13 champions were already practicing, if I could use that word, when I started on the 2nd of November. And then we had training on the 2nd of December. We had another cohort of champions trained. And then we have recently had our champions training on the 22nd of February. So if you're one of them, you might want to tell us maybe like how long, or are you still waiting for your training, etc., and a bit of how things have been going. Just feel free. So we've got introductions until about 1:15, so there's no rush. Right, so if I can start with you, Gail, please. I'll just use, from the left of my screen. Gail, please.
I am Gail Bennett. I'm a recruitment and retention and wellbeing matron for Rampton Hospital. I did my first part of my training on the 23rd because we'd only got 2 champions within the hospital, but we have got other people booked on for the training now. So.
Thank you, Gail. Very pleased to have you on board. Hi, Jane.
Hi, my name's Jane Bestwick. I'm Quality Improvement Lead for the Forensic Division, and I am doing my training next month.
Thank you. Welcome on board, Jane. Amy?
Yeah. My name's Amy Dockich. I'm a specialist mental health practitioner at the Mandala Centre, so previously the Personality Disorder Network, or the NOTS MBT service. I'm the newbie, so I've not done any training yet, and I'm kind of very new to the Freedom to Speak Up champion role. I guess today will be really helpful just to hear from all of you and a bit more about what's kind of involved. So that's me. Thank you.
Thank you. Jenny?
Hi, I'm Jenny, Multimedia Engagement Manager. Just do get things digital. I was due to be a champion a while ago, but I only managed to get training done it was your first lot of training, Simbi, so that would probably been January, February time. Thank you.
Thank you, Jenny. Good to have you on board, and thank you for your assistance and support for today. Sharon?
Hi, I'm Sharon Howe. I'm head of nursing in mental health services for older people. I think I got trained up over 2 years ago, so it does seem a long time ago, really. But I have to admit that we only did the training and nothing else since. So it's good that we're here today to keep following this up because it's quite important. Thank you.
Yes, that's great. Thank you, Sharon. I think we had our last forum on the 8th of December. Some people might have missed it. So that was the last time we met. So I started the role on the 2nd of November, and then we had a champions forum on the 8th. We had another group of champions trained on the 2nd of December. So yeah, it's lovely, Sharon. We'd like to keep meeting up, and today we're going to agree on the frequency of our meetings. Thank you. Move over to Natasha.
Hiya, I'm Natasha. I'm an administrator within the Staff Health and Wellbeing. support service. I've recently trained in February, which I really enjoyed. So yeah, that's me.
Thank you. Thank you. We'll move over to Farida.
Hello, I'm Farida Lingard, or everyone calls me Fred, and I'm a clinical specialist. Yeah, clinical specialist physio in mental health services for older people, and I also work clinically a couple of days a week in the city in Nottingham. I did my regional training on the 22nd of February as well, but prior to that, I think I only volunteered to do this in December, so I'm pretty new as well.
Brilliant. Welcome on board. Right, I've got about 4 champions there that I can see your faces, but can we have BB first to introduce yourself, please? Becky, hello, it's you.
Hello. You're all right.
Yes, thank you.
Morning, everyone. My name's Becky Burney. I am a project manager for a new team in CAMS called the Mental Health Support Teams. Previous to that, I'd sort of managed the Prime Mental Health team, which are both early intervention teams within the CAMS service. I did the training on the 22nd of February, the first part of the training, and I think I'd volunteered to be a champion in the summer-ish time last year. So been waiting to do this for quite a while, something I'm quite passionate about.
Excellent. Thank you, Becky. Next, we'll have NG. If you don't mind putting your camera on while you speak so that we... Oh, it's Nigel. There you go. Nigel?
Morning. Nigel here and Chuck. I'm the Involvement and Experience Lead for Forensic Services, and I believe I was in the first cohort of the training that you organised, Simbi. So like everyone else, want to support what we're trying to do.
Excellent. It's nice to have you on today with us today, and I'm sure we will learn a lot from each other today. And next on my screen, I'll have MD. MD, please.
Hi, I'm Melissa. Hiya. I'm in administration in the governance and investigations team for adult mental health, and I completed my regional training on the 22nd of Feb, but this is an entirely new role for me, so this is my first forum.
Excellent. I'm sure you'll find today's meeting useful, and it will also form part of our second part of the training. Thank you. And we'll move over to NB. NB on my screen.
Sorry, Simbi, that's me.
Oh, that's Taisha, of course. Oh, yeah, because you're taking your face off. BB has spoken. I think that's Becky. Nigel has spoken. Anyone else who hasn't introduced themselves? Is that everyone? Okay, ready to start the meeting. I haven't introduced myself. So I'll introduce myself. Some of you might have heard me speak or introduce myself in other forums, or if you attended our last Champions Forum, then you'll have heard me. So I'm Simbi Sibanda. I'm the guardian for our trust, Freedom to Speak Up Guardian. I started the role on the 2nd of November 2020. Prior to that, I was a staff nurse within our forensic division. So I already worked for the trust, not for very long, but for a significant amount of time within the trust. So I feel like I identify a bit more with the forensic, although obviously I've had lots of experience within health and care, health and social care. But prior to joining the nursing profession, I was a school teacher. I worked for many years, if I tell you how many, that might give away my age. But for many years, I was a school teacher, secondary school teacher, both in the UK and abroad. And then I've had some experience of teaching in further education as well, where I worked as a lecturer of health and social care. And then I decided to switch to nursing, a role which I really enjoyed, and still got that passion. But when I saw this post advertised, I thought, well, I think I've got lots of transferable skills to be a guardian, because I think what you do when you are a teacher, you prompt your students to say, what do you think about this? How have you show me how you've arrived at this? And you are constantly asking them to improve themselves. You're monitoring their progress and everything. And freedom to speak up is about learning from our mistakes. It's about trying to make improvements. It's about saying our opinions and working together to improve things. So I saw myself having, that passion about speaking up, because I felt it's something I've done for a long time. Also, I've had some experience of working with supporting adults with learning disabilities. I worked for Rotherham Borough Council for a while, just as a part-time during the periods of my studying, because I've been really committed in lifelong learning. I've been like in and out. I do a full-time course, I go back to my teaching role, etc. So I did learning disabilities. I also worked with young people in care. I've had experience in that, etc. So the caring sector is an area where I'm really passionate about, especially when it comes to making improvements. So that's a little bit about me. In terms of my hobbies, I do like walking, I do like baking, I do like sewing, and I do like ironing clothes. I do find ironing clothes quite therapeutic. I don't know how many of you would like ironing clothes. Yes, I can see Fred shaking there. Yes, I do I can iron for hours, as long as I've got some music or something, I can carry on ironing. I'm also a school governor. I like to give back into my community a bit of my time. So I am school governor at the local secondary school. So yeah, that's a little bit about myself. You will hear a bit more in my presentation with regards to what we are trying to do. So we will move on now to today's business. Did anyone have anything to say before we start? Okay, I'm not seeing any hand. So I'm going to share some slides and I'll share what I hope we will achieve today. Right, I hope everything works well. Right, okay, and it's my PowerPoint, is that one? Okay. Is that visible? Can you see something on there? I'm going to share slide from beginning. Yeah, great. Yeah, so I intend to cover or to give you an idea about our local Speak Up vision, our plans and strategy, share with you a bit of with regards to our local data, how things are looking like with regards to speaking up, and share with you a bit about our local arrangements, understanding of what the champion role looks like, especially for the benefit of those who have recently had their training. So we'll have a bit of clarity of expectations within your role and how it links with the Freedom to Speak Up Guardian. I will also talk a little bit about our local reporting arrangements, how you report to me when you have supported someone. And then we want to agree on the support arrangements that we want, and also how we ideas about how we can raise the speaker profile. If everything works well, we might, with our numbers, I was hoping that we'll do breakout rooms, but I think, yeah, we'll still do, I think, so that we can speak up in smaller groups and be able to come up with ideas about how we can improve our visibility within our workplaces and how we can raise the freedom to speak up profile trust-wide. I will also like to share the vision, the Freedom to Speak Up, the National Guardian's 5-year Freedom to Speak Up vision or agenda, if time allows. So yeah, generally that's a bit about what we want to cover. So our motto within our trust, the motto that I came up with as your guardian, we want to make freedom to speak up business as usual. I think we do understand what we mean when we are saying something is business as usual. It means it's just happening spontaneously. It means that it's smooth running, that people feel able to speak up. Not only to the guardian, is when people can speak up to their line managers in their meetings, in supervision, people feeling that they can speak up anytime and to anyone whom they need to speak up to. But before that, then I'll just give you an idea of the people who matter when it comes to freedom to speak up within our trust, just some of the board members and some of the people whom we link with as freedom to speak up people, you including yourself, myself as guardian, and you as champions. So we know that at the top within our trust, we've got our chief exec, who is John Bruin. I didn't bother to put pictures there. We all know John. And then we've got Paul Devlin, who's our chair. I report to Julie Hankin. Julie is the medical director, and she is currently responsible for freedom to speak up. Some of you might have noticed that there was an announcement in John Bruin's email that Dr. Hankin will be leaving the trust, I think sometime in April. So it might be that the freedom to speak up guardian, or the freedom to speak up will be moved to another. I don't know what's going to happen at the moment, but currently I do report to Julie Hankin. She is responsible for freedom to speak up. And then we've got Steve Banks, who is our non-executive director, responsible for freedom to speak up. I meet with Steve every month. And we've also work with a director of workforce, and also different heads of workforce. That is, when a concern has been raised, I link up with heads of workforce, etc., to look into things and to make sure things are improved or whatever needs to be done. So they matter a lot within the freedom to speak up function. Culture and engagement, I work with them a lot, and organizational development, quality and standards, etc. So I just thought I'll just give you an idea of who matters when it comes to freedom to speak up, but of course it's everyone else. Everyone else matters, people bringing their concerns and whoever need to look into that and improve things. Right, so freedom to speak up. We are in unprecedented times where speaking up is more important than ever. I think the word unprecedented, we've heard it now many, many times, but that is true. That's the situation we are in. Speaking up has always been very important, but now I think it's even more important. People are tired, people are worried, lots of adjustments and changes people have had to put up with. So things can go wrong even with all the intentions. So if there is no good speaking up culture, it is likely that things can go wrong, which is why I believe that speaking up is more important than ever now. So speaking up is about anything that gets in the way of providing good care. Speaking up will ensure that both patients and staff are safe. You have already covered this. Some of you who have recently trained, that's the whole idea about speaking up. I quite like the words of Sir Robert Francis, who has summed up what speaking up is and why it is important. He said, failure to speak up can cost lives. We need to get away from the culture of blame and the fear that it generates to one which celebrates openness and commitment to safety and improvement. If these things are achieved, the NHS will be a better place to work. Above all, it will be a safer place for patients. So this is why we need to speak up, to make our places safe, to make improvements, and to make sure that our ourselves as well, our health and well-being, that we are happy. I always like to show this slide. You would know some of these stories. We have seen, we have heard, the images have become familiar when opportunities were missed, when someone spoke up and nothing happened, or someone did fail to speak up. We know the Winterbourne View. I remember that documentary was 2012. I remember dropping a tear when that documentary was on. Adults with learning disabilities, you'd see staffs, sitting on top of a service user, pouring cold water over a service user, abusing them, teasing them, patronizing them. It was so evil. And to think that some people would think that's normal and leave it like that, until that undercover reporter went in as a worker to unveil everything that, to expose everything that was happening. So we don't want another Winterbourne View. We don't want another Mid-Staffordshire in our trust, which is why we are encouraging people to speak up. As champions, it's important that we are letting people aware that if we don't speak up, mistakes will happen, and some of these mistakes can cost lives, just like it did on our little baby P there. Right, okay, so in terms of the guardian roles, just a quick reminder, some of you who have recently trained, your training covered a bit about the guardian role and your role as a champion. So I also want to just refer to this briefly. My role as guardian is to support staff in raising concern by offering an independent and confidential service as per recommendations from the Freedom to Speak Up review, and to remain independent from current structures within the organization. So in as much as I work with all the internal stakeholders that I've shown on the slide, I am not part of HR, I'm not part of any of those, but we work together to improve things for everyone in the trust. And I work with you, working with champions to improve the speaking up culture within our trust. So I work alongside key stakeholders, external and internal, promoting an open and honest no blame culture where staff are able to raise concerns safely without fear of reprisal. And my role is also to ensure that all concerns are stored and recorded in a confidential manner, and also identifying the themes, what are people speaking about within our trust. And then I regularly disseminate this information to the board of directors and also report to the NGO, to the National Guardian's Office. This information is available on national database. You can log on to the NGO, you can see how people are speaking up in our trust as well as other trusts, and you can make a comparison. So, and also my main duty is to raise awareness about speaking up, which is also one of your main roles as Freedom to Speak Up champion. Your role is to raise the speaking up profile. So your role is very, very important as champions within our trust, because our trust, due to its complexity, its geographical spread, like for example, we've got Worthwood down here, and most of you maybe around Nottinghamshire, some it's even spread to Leicestershire. It's really wide, it's widely spread. So we do need champions. Preferably every service should have a champion, so that champions can offer support and guidance to those willing to raise concerns, and also so that you can encourage staff to raise concerns at the earliest opportunity. Now, this is one of our primary roles as champions, to encourage staff to raise concerns at earliest opportunity. Now you will say, how can I do this? This is one of the main aims of our meeting today, to see how can we encourage staff to raise concerns at earliest opportunity. How can we champion a culture where raising concerns becomes the norm? Now, one of the methods may be, as we are going to discuss later on, but maybe you can utilize staff meetings, team meetings, away days, or in your supervision, or maybe you could have let's talk time, where you just have some coffee and people come around and you talk. I'm really eager to hear some of the methods that some of you guys have already used or that you intend to use in the future. So we want to be visible, and we want people to know that we are there as champions, and we will be sharing some of these ideas, as I've said. So we desire to have champions. We're still recruiting, and my desire is to have champions representing the diversity of our workforce, and all, both non-clinical and clinical staff, those on the shop floor. It's nice to have champions as well who are maybe leaders, but if we can have those led as well, being champions, because they already know what's going on and what people are concerned about, and maybe they can relate more to what the concerns that people are bringing. So all of us with our diverse skills, we can bring into this role. Okay. So in terms of our local reporting system, some of you who have been doing this, you may have noticed that I started a Teams team. I don't know what this is called, but Microsoft Teams. We've got our Champions Forum Teams group, where we're posting information there. Some of you have been accessing it already and responding on the chats there. There are folders there with information that we need, and I hope to put more information in there as well, so that anytime you want some resources, they are there. So we've got a reporting system where you can complete a form, this form that I'm displaying here, Freedom to Speak Up Champions Concerns Raised. That's the form for reporting concerns to the Guardian. So it's got the date, the concern was raised, name of the reporter, etc. You can briefly write what the detail of the concern was, etc. Just so that you can email this form to me when it might be that you've just had you have just had a meeting with someone, and they just wanted a chat, but they don't want anything taken formal. They wanted someone to listen, and maybe it's something that they don't wish to raise further, but so that we know that you are working, you did something. You may just want to jot a few lines just to say, I met a colleague who had some concerns, but they're not wanting anything done, or they've wanted me to support them to speak to their manager, for example, or whatever it was, you just summarize and forward it to me. Or you might have had some events as well within your service that you just want to feed back to me. You can either complete this form or just write an email. We've had this, and this is what happened, so that at least we log this down. It's good for presenting even to the boards, showing the work that the champions are doing. So that's how we work together, yourself and me. Then there might be situations where it's really it's something that you can't handle. It's a concern that is huge, and maybe it will need to go through some process. It might be a grievance, it might be whatever it is, but you think the Guardian needs to know this. You can phone me whenever, you can call me or you can email. If you think it's not urgent, that you can raise it via this reporting system using that form, that's still fine. I am accessible by MS Teams. You can just try to call quickly on MS Teams, or you can use my works phone. Please just act promptly if the concern is urgent, so that we can work together. I'm here to support you as well. When you have taken a concern that you think, you do feel very uncomfortable with, and it has disturbed you, anytime you can seek supervision with me, and we can have a one-to-one, and, because you can't, obviously, maybe sometimes not always be able to speak to your line manager, because people are raising to you in confidence, unless they have said it's okay for you to speak to their manager. Now, we'll discuss a little bit more on this. I know you'll have questions for me. That video we'll watch in a bit. I'll come back to it. Right. I feel like pausing to entertain questions there before I share our vision and the strategy a little bit, because I think I have spoken for a bit. What time are we on? Yeah, I am going to stop sharing for a little bit. Then I'll share our strategy, our local strategy afterwards. Let me see. Stop sharing a bit and entertain some discussion or questions. I think it would be a good time to pause, because I think you might have some questions for me with regards to what I've said about how we work together and how you can report to me concerns that you might have. Does anyone have a question at this juncture? Do you have any question or contribution or an experience that you have heard that you might want to just kind of, share, or, yeah. Oh, I can see. Natasha, you got your hand up. Mm-hmm.
So this is just for some of the minutes. So you said we're still recruiting champions. How many champions do we have at the minute?
Okay, very good point. Thank you. So at the minute, trained champions, we have 25. We have 25 trained champions. And I've already asked... I think you received a prompt to say, are you happy for your for your name and your photograph to go on Connect, so that if people want to contact a champion, your details are there. I hope that you have responded to Nicola or to myself. So we have 25 trained champions. We've had a few who haven't responded. They want their first cohort of champions. I think I've got 2 only who haven't confirmed if they are still willing to continue, if they're still practicing champions or not. And I've got about how many untrained? About 12 that are still waiting for their training. Yeah. So 12 plus
12 plus. Okay.
Plus 25, so 37. Right. That's a very good question. What I know is that our trust is we've got about approximately 8,000 staff. And how many services, if I still remember that detail, remember asking so that it could give me an idea of how many champions we might need. I can't remember how many services in total, but we have many, I think 300 something services within our trust. So that's a big number. Obviously, I wouldn't look to have 300 champions. That would be a really huge number for me to manage. Would maybe need to have maybe 4 guardians or something like that. That's one thing that I'm thinking as well while I'm recruiting, to say I need a group of champions that I can be able to work with, a reasonable number. So far I was thinking maybe approximately 50 champions, if we have 50 that are trained, because we know that due to the diversity of our roles, like we can see today, how many are we on here? Because we know that not everyone can be present, even for the forums. People will be busy, etc. And I think the more we are, the better. In terms of supervision, we can always maybe, arrange as and when people can manage to fit it in, etc. So yeah, in my vision, I'm thinking at the moment maybe approximately 50 will be a reasonable number. And also, once we have our names and photographs on Connect, people don't necessarily need to contact a champion within their service. It might be someone might, look on Connect and say, oh, that's Natasha. I think I will speak to Natasha. Or they might say, I want to speak to the Guardian. I don't think I want to champion, but they might just want to have a chat with someone else, not someone from their service. So, which is why we need that visibility to be on Connect, so that people can just click, our email details are there and they can chat to us whenever. Okay. Have I answered you?
Yeah,
Thank
I've
you.
got one more question on the form. Just to clarify, is this form available on our Teams within Teams?
It is, yes. Excellent. It is available. Yeah.
And in the form it says ethnicity of the reporter. So that is you as the champion, or the person that's you, or the champion, or the person. Is it it says ethnicity of reporter? Does that mean the ethnicity of you or the ethnicity of the person that's raising the claim?
The person that's raising a claim, yes. Because the reason why we need that data, on my Guardian tracker or concerns tracker, where I capture all the details, we also have we got a drop down for ethnicity. It's actually good data just to see whether there are any other, groups of people who are speaking up, who are not accessing speaking up, and what can we do to reach out to them. So I suppose that's why it's important to have ethnicity there. Yeah, so it's about the person who's raising the concern. Okay. While we are on ethnicity as well, maybe if I can just give another detail with regards to our champions mix as well. Well, I might not be correct, but when I was looking, I think in terms of our ethnicity mix as well with regards as champions, because as we know, this is all kind of important detail. I think we got 9 of our champions who are of different ethnicity, so which is actually quite nice as well, showing our diverse mix. So we really want, even in terms of our roles, we've got administrators, we've got healthcare assistants, we've got volunteers, we've got managers, we've got quite a good mix of champions, and we really can't wait for our information to be on there on Connect, just showing how diverse we are with regards to our our professional backgrounds and everything else. Right, we've got Deb. Deb, you've got your hand up, Deborah.
Hiya, you may be covering this later on. Just if I'm jumping the gun. But one of the issues is gaining that protected time. So obviously that's a big problem, for everybody. So how are services open to that, or is there a policy around that, or because obviously that's going to be a huge get round. I know my own team they've not exactly been amenable, but it's understandable. We've got COVID, we're busy, so how further forward are you in having that protected time secured?
Thank you. Yeah. Thank you. Good question. Thanks, Deb. Yes, it's something that I knew from the very day I started that I will need to get protected time for champions, and I think I've been mentioning it to my line manager, to Dr. Hankin. So what she has said to me is to put it in writing to ELT, Executive Leadership Team. Yes, I had put it on my recent board report and asking for at least 7.5 hours per month. But then she got back to me saying I don't need to put on that report, but I should write a separate kind of like just a 1-page explaining why, justifying why I think 7.5 maybe. But since we are doing this forum before I write that letter, I think we could maybe agree on what you think is reasonable. I was going to ask board for at least 5 to 7.5 hours. 7.5 hours, I was just thinking, if you have one day within a month where you can dedicate to your champions duties, maybe you might decide to have a coffee morning or a drop-in session where people just come in, to have a chat, let's talk, and you can dedicate the time to, whatever you think promoting Speak Up. So I was suggesting 7.5 hours. I don't know what you think. Do you think it's fair? I'm hoping that after today, no, I won't do today because tomorrow I've got board development. This week anyway, I am writing that. It was just waiting for me to put this all and justify the reasons, etc., and send it to board. So it shouldn't be very long before we have, and Julie doesn't think the board will have issues with that. We really do need the protected time.
Yeah.
Yes, thank you.
Okay. I mean, yeah, that's fine. Just one more question.
Yeah.
I mean, it obviously, different managers manage in different ways. But how much of that is going to be, in policy or, freedom to speak up? We're going to go. If you're not happy, it's set in stone. This is the protected time that we have, because obviously that is going to be the biggest issue. It's all right saying it verbally, but we kind of need it really in in some kind of policy that it can be on Connect, as under the freedom to speak up, so managers can go to it straight away and obviously realise that's what it's that's what we're tied into.
Yes, definitely. Yeah, I think it's a very good point you are raising, and I know due to the nature of our services varied, and in some services it will probably be very, very difficult to get that time. But as you're saying, if it's part of policy and it's really protected that time, then they need to make sure that you get the time. But speaking from experience within forensic division, I know that sometimes it can be difficult to cover shifts. I would be given sometimes a named nurse day, and it ends up being taken away because you need to cover the ward and come and help with ward round and etc. And then you have to drop 3 hours of your named nurse day to go and help out. So it can be difficult, but I think as you're saying, it's very important that this time be there. But I will be maybe trying to to advocate that it's secured. We can always try.
It's all right, the executive saying, oh, you don't have to put it in writing, or you don't have to, but we know what happens with regards to that. If it's if it's not down, it's if it's not it's not happened. So I really think it's quite important, and that's how you're going to get the buy-in from other champions as well.
Really good point. If in the Freedom to Speak Up review that we are having, that has started, one of the requirements, they are asking the time for do your champions have protected time? So for now, because we haven't got it in black and white, I will be saying know, because we haven't had this confirmed. But it's something that for those of you who will be meeting with Rachel Clark, the Freedom to about the review, NHS improvement, those of you who are going to have a chance of speaking to Rachel, I think we can be indicating that it's in the pipeline, maybe for us to get protected time, but currently we don't have. We're hoping that we will have, and chase it on me if it hasn't been confirmed in the next couple of months, because it's something on my to-do, and I have to make sure I advocate for this to be, maybe it should, as you are saying, be included in our policy as well, in our freedom to speak up policy. Okay. Thank you for that point. I'll move on to who was first. I think it was Gail, then I'll go to Jane. Right.
I wholeheartedly agree with what Deborah's saying, and if when people are looking at a service, they look at these sort of protected times as in non-effective, which I absolutely hate that word. That's how it's looked at on the health roster. These are non-effective days because they are training days and things like that. I think, moving forward with it, I think it's something that we have got to push for. I'm very mindful that within the board this month is going to be a proposal for 4 hours protective time for wellbeing champions. And my worry is that the board will start, and I know that there is going to be a proposal put in for protective time for mental health first aiders. My worry is that the board will look at this and say, how much of this time are we giving to people for doing these additional roles which people actually volunteer to do as the normal day. Me moving forward, just an idea in my head is that, I do think we should protect this time for people. I think we need to be looking after our workforce now more than ever. They're absolutely on their knees, and getting this protective time actually put into health rosters. So when rosters are being planned ahead within 2 months' time, that these days can be in, that it's on the drop down box when you are putting in this time, that it can be put into rosters. So when them rosters are signed off, that they've actually, that time's already been factored in. I know things will crop up on the day and people will say, you've got to drop that day. But I think also looking at things that when people have got protective time, that they're not actually turning up to their ward area or where they are going to get sucked into numbers, that they actually have that protected time away from their day-to-day clinical area.
Brilliant. Thank you. Very valid points. Thanks, Gail, for that. Jane?
I was just thinking, I must speak. Can you hear me now?
Yes, we can hear you.
What I was thinking in terms of like the coffee morning was something that really resonated to me, which I could really think, and I think we do ourselves a disservice really, because what we need to be doing is putting it out there that like every month, one day a month across the division, there is a guardian, a champion there, and you get it out there on a global email to say, right, this is your opportunity. Somebody will be there between the hours of 8:30 to 4:30. There will be a champion there, and if you want to come and talk about something, fantastic. But ultimately, like I think a lot of people here work across the division. I'd be more than happy once I've completed my training. It's like going to Wells Road for the day. Speaking with Jackie and saying, look, Jackie, I'm coming over this day. Can we get an email out that we're going to be there in this area for this time as a drop-in, and then roll it out. I think that'd be really powerful to do that. Then if staff need to leave the board just for like 10, 15 minutes, just to have a chat, you're there, you can listen, they can have a cuppa, they can talk to. And I think, it's an opportunity. We're not just paying lip service to this. We are actually getting out, putting ourselves out, doing it. Because, I worked with Gail. I've worked as part of Gail's team for a long time, looking at the wellbeing. And, you know, a lot of the time you want to do more. You know, we really, really want to do more. But like Gail's just referred to, having these people, you know, hours for this, hours for that, and then we're in a pandemic, and there's always something that's more important than giving people a voice. And I think that we really, really need to push back on that and say, right, once a month, on say the 4th of April, there's going to be a coffee morning, freedom to speak up. If anyone wants to talk, you know, and then maybe do it another day of the week at Wells Road, another day of the week, you know, and roll it out like that. Do you know what I mean? I think it'd be really, really good. We're missing a trick if we don't try it. If it doesn't work, we haven't lost anything, have we?
No. Brilliant. Wow. Excellent idea, Jane. Thank you for that. And I think it's something that I also, as Guardian, I could use the same kind of approach, the monthly drop-in into different services, especially after the pandemic. I know that not all places at this time, the physical presence may not be possible, but I think even the virtual, it might be good, even virtually as well, dropping in. I've already started, well, it's random. Maybe I'm doing far more than once a month because different services are inviting me to, you know, to their meetings, etc. But from what you are saying, it's a forum where people can drop in, the people who need to speak, not only just addressing, you know, managers meeting or senior nurses or whatever, but people on the shop floor who may have things to talk about in chat. So it's brilliant. It's really a good idea. And if we could do that as champions as well, that would be really fantastic. Once we got our 7.5 hours per month, I can't see why we can't arrange things like that. Because sometimes it's not always about talking about huge things that would need any. Sometimes people just want to talk. It's therapeutic, you know, coming and talking about what's happening in our service, this, that. Maybe you pick a few things there that you think this need addressing. Some of the things might need very little, you know, kind of, it just needs someone to hear that this is what people are saying.
And to hear their voice for me.
Exactly.
It's you know, if you're there, people might say to the nurse in charge, right, I'm just going to nip up on my break, and they may want to come, they may want to drop in and just, you know, we've been really struggling, blah, 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 blah. And it might just be a simple, easy fix that's the listening. And they know it's in a safe place and that they're able to do that. And it's about enabling them and giving them the opportunity. And I think, you know, it's about putting yourself out there for people, because I think in times that we're in at the moment, and I know we've said about unprecedented times, we've brought that up, but it's not. I think it's important that it's just not we're acknowledging it, we're actually being responsive. We're not actually. Yes. Do you know what I mean? We're being responsive to them. Yes.
Yes, not proactive. Who was first? You got Natasha and Deborah. I don't know who was first. I'll start with Deborah, then I'll come to Natasha.
Natasha was first, actually.
Oh, Natasha was first. Okay, Tasha, go on. It's all right.
Yeah, it was kind of linking into what Jane was saying, but in the staff health and wellbeing support service, we are doing a monthly drop-in on Teams on the last Tuesday of every month for 3 months to see how it goes, for people to come in and drop in, see what our service is about, see how we can support staff. Now, I think, and I know I've said this to you before, Simbi, there are wellbeing champions, they're mental health first aiders, they're freedom to speak up. We are all services that support staff and better patient outcomes. I really believe that we all need to kind of work in unison. So if one's got protected time, the other needs protected time. But also, if there's a situation that comes up with a wellbeing champion, that they've spoke to a member of staff, that they're able to pass that on to freedom to speak up. I think we all need to come together as a support network of our staff to improve our staff's well-being, but also improve our patient outcomes. We are a support service, a network. But my other question was, do we have a mailbox for freedom to speak up? Because the only reason that I ask that is that sometimes it's easier to put in writing and send an email than sit and speak to somebody. So I was just thinking, if we supported a service where if you have an issue or if you would like to speak to someone, please send us an email, and that email's picked up or passed to a champion or goes to the Guardian, and it's just another way of connecting with people, staff that do want to raise issues. I don't know if that is a thing, Simbi.
Okay. Yes, we currently do not have what we call that kind of email. I know what you mean. It's not a global email. You mean as in a shared inbox? Is that what you mean? Yeah, a shared inbox where people can just drop into the. I once thought about it, but I was thinking since it's. Because even if we had it, I don't think it would be one where the champions would use as well. I think if we had a shared inbox, I think it would probably, if we had maybe two guardians, then they would use that. I don't know, due to the nature of the sensitivity of the things that people might want to raise. I'm not sure. Do you want to maybe shed a bit more light of how it would work, this shared inbox, Natasha? Maybe I'm kind of lost in my head.
So as a mailbox, so say a freedom to speak up email, just freedom to speak up email. It will be a mailbox. It will be on Connect. People could send an email to that mailbox if they wanted to speak to someone or they wanted to question. At the minute, it's just your email on Connect. I'm just thinking that sometimes when there's just a phone number or something like that, it's a little bit harder to speak to somebody. But I was thinking, if you send an email to a mailbox, it might be a general inquiry. I mean, lots of support. We have a staff support mailbox where we have mails come in. It is managed by a few people, but I'm kind of thinking about it now, Simbi, because you are just one guardian. It would kind of be down to you to kind of manage that mailbox. So you don't have admin support, do you?
Yes and no. I have, but not a kind of full-time one. I've got someone who can support me a little bit with some admin. I've asked for that. I will have to check how much time, she can have for supporting or working with me. But it's a brilliant idea. I once thought about it as well, because sometimes there are a couple of times when someone has written to me saying, you still haven't responded to the email I wrote you on this day. And it was to do with a concern, which I really felt bad about, that I had missed a very important email that I should have responded to. Now, this is because my inbox is everything from John Bruin's updates, daily updates, to everything else, the concerns. So if I have an email that is dedicated to Guardian stuff, I think that's a brilliant idea. I'll take that on board. It's something that I will be pushing to get. I think it would help to separate that, so that people will just email Guardian and not that, and then they put their concerns that way. Thank you. Brilliant suggestion. Jenny, you've got your hand up, and then I think we'll need a break afterward. Oh, we've got 3. All right, I'll take all the questions, then we'll have a conflict break and then come back and finish our last session. Right, Jenny, thank you.
Yeah. Hi, thanks for that. Just to follow up on the email issue.
Yeah,
I absolutely agree. It's really important, and even if it's not a shared inbox, it's that you have got a generic email inbox, and that is part of not just
email, but it's part of a wider thing about branding and being recognisable, being accessible, so everyone gets to know that if I send an email to, I know it's abbreviated to FTSU, but I think a lot of people don't really know what that means. So whatever the email address is, it would need to be in language as well. And I think that's another thing for the branding aspect of it, that we have to communicate in the way that people speak.
Yes.
So otherwise it gets lost. People don't really think it is. They think it's not for them. So so that's part of it. But definitely a generic email address is really, really useful, so that it doesn't get lost. Your emails doesn't get lost in anyone's emails. And if it comes to a point later on down the line that you do want to share access, you can do. Definitely, I'd agree with it.
Fantastic. Thank you for those suggestions. I'll go to JB and then DP after. JB. And any other comments that you might want to make if you think you haven't been heard, also just put in the chat box. Then we've got that. So don't let anything, go unsaid that you wanted to say. Just put in chat box. Okay, JB. Thank you. Is JB?
I think that one was that was from earlier, Simbi. That's an old one.
Was it? Okay, that's fine. Okay, no problem. You can put your hand down. Thank you. DP, thanks.
Yeah, just a quick thing, really. Just going on from the good idea about the coffee mornings. If you can imagine, there are probably quite a lot of staff who may not want to say something regarding a business meeting or a service improvement, or something that's detrimental to themselves, or that's potentially has an impact on the service. So even if it was a coffee morning, with regards to that, then it would be an opportunity for them to be able to flag it up to each individual service that there's something wrong. So so if there's an opportunity for you to sell it like that, going back to the protected time and for coffee mornings, it being because not everybody's got the confidence to speak up at a a meeting, a business meeting or anything like that. So so it'd be an opportunity to do that in the coffee mornings and then feed back to the particular service.
And in those meetings as well, it will give us the opportunity to let people know that they can speak up to their managers, and if they don't feel comfortable, they can speak to you, they can speak to the guardian, and mentioning all these routes that are available, or even speaking to your union, because right now, as I was going to mention in the next meeting, we've had quite a few cases of whistleblowing, if I could say. I know those who have recently done training, you knew that whistleblowing is part of speaking up, but whistleblowing mainly when people are speaking outside the organization. We've had quite a few concerns raised via CQC. Now, this is something that we do not really want to see happening at a larger scale within our organization. We want people to be able to use available routes for speaking up. So when people start going to CQC, it sends a message that we haven't got a healthy speak up culture. It shows that people are scared, there's detriment for speaking up, which is our duty, which is why we are here as champions to cultivate a positive speak up culture, to say, look, we can speak. If it happens that there's detriment, again, that's one of the champion roles. If anyone has spoken up and they tell you that they think that they are suffering reprisal or detriment as a result of their speaking up, please raise that with me. No one should be suffering as a result of speaking up, or they all of a sudden get given some odd shifts or something else is happening and they feel that they are really, their relationship with the manager has been affected as a result of what they have said. These are all things that we should be raising concern and flagging up and making sure it's addressed, because we want to cultivate a healthy speak-up culture. Right, so it's nearly time for our break, but I also thought before we break up, I want to mention something that we will probably discuss this in our next session, about making freedom to speak up a standing item on the agenda. It's something that I'm advocating for, and tomorrow I'll be saying to the board as well, to say, just as we have safeguarding, we have all those things that are in supervision and in our staff meetings, team meetings, we've got them as an item for a standing agenda item. If we have freedom to speak up, maybe it will just encourage when say anyone about freedom to speak, anyone with something for freedom to speak up, maybe it might just prompt people to speak up. We'll discuss this a little further when we come back after. So in the next session, what I want us to do is just to share our freedom to speak up strategy, and I will share with you a little bit of how it looks, what speaking up is looking like at the moment within our trust, share a bit of data with you, and then we'll end up by looking at how else can we raise the speaker profile within our trust. And I think because we are, how many are we in number? I think, Jenny, we might be able to do without having to break away. I think we are a reasonable number. We'll just use the same method that we have done now and to put our ideas together on the 3 questions that I would want us to end with. So yes, let's take a 5 minutes break and come back at 15:15 to finish the last part. Thank you. Okay, so we'll carry on with our second part. I'll start screen sharing again. I hope we managed to make a drink. Oh, someone drinking water. I've got my water, but I decided to go for tea. I got my cup of tea. Oh, yes. Can see who's healthy. Oh, goodness. I should have stuck with my water, but I felt I needed. Right. Okay, we'll carry on. Time is just not on our side. Right. Can you see my slides? Can you see something? Oh, am I on mute?
No, I can't see anything yet, Simbi.
Oh, right. Oh, I hope it doesn't do what happened last time. Okay. You can't see anything still. Okay. Right. I will close the and open it again. Some people have, right. Bad thing about technology. Right. Where's my PowerPoint now? Right. I'm just opening it up again. I closed the PowerPoint so I can open it again. Hopefully it will. It happened there was a time when I stopped sharing. Coming back to it, it didn't work straight away. Some reason. Right. So I will. Right, okay, I'll try and share again. Can you see something now? Can you see it now? No?
No.
Oh, what's that? Right. Right, 25 to from there.
That's
it. Ah, you can see now. Oh, that's better. Well, I was already panicking because time is not waiting for us. We've got 40 minutes. Okay, I hope we'll be able to. So from current. So I wanted to start by sharing the vision, our vision for freedom to speak up strategy. So we want, our vision is to create an open and transparent culture where staff feel free to speak up, where concerns are being acknowledged, acted upon, and feedback is provided. Staff are confident to speak up without fear of reprisal, and to embed a culture where speaking up is seen as part of who we are, and a great opportunity for the trust to take the learning in order to contribute towards quality care and staff engagement and well-being. So that's our vision. And so our three key priorities: to embed a culture throughout the organization that embraces all aspects of speaking up, all of them. Secondly, to ensure that all concerns raised are responded and actioned in a timely manner. And thirdly, third key priority is to utilize speaking up as a tool to learn and to improve and share best practice. So what are we doing in order to address or to be able to achieve these key points? I will just only cover priority one. How are we trying to embed a culture throughout the organization, a culture that embraces all aspects of speaking up? So one of the ways we will try to do, or we are already trying to do, we are trying to encourage a culture of learning, not blaming, in order that speaking up is embraced as a tool for promoting quality care and improved staff experience. We're working together with organizational development, with the people and culture, with everyone within the trust, with stakeholders, to embed our restorative, just and restorative culture, so that people are not blamed, but we're learning from a culture of learning, so to speak. So where there may be an indication of areas where speaking up is not positive experience, we will try to provide a cultural review into the service in order to ascertain any areas of improvement. This is already what is happening. Some areas of our services have had cultural reviews where, staff voices are heard and trying to find where things are going wrong. Also, we're trying to ensure that all our staff and volunteers and the seldom-heard groups are aware about speaking up, the Freedom to Speak Up Guardian, and the Speaking Up agenda and Speaking Up policies. And we are trying to have champions and recruit more champions to try and raise the Speaking Up profile. With regards to seldom-heard groups, is one of the things that I am going to want us as champions to put our heads together to see what can we do. Those of you who have just recently had training, I don't know, they might have used the word vulnerable groups. I have since challenged that terminology to say if someone is BME or they've got a disability, or maybe they are off-site workers, or they are agency staff, I think those groups were traditionally identified as vulnerable groups. I have challenged it to say, I don't agree that someone will become vulnerable just because they are a minority, or they've got certain characteristics about them. It's kind of like a negative connotation, but I do agree and understand that there are some groups, certain groups that are seldom heard, and these are maybe due to their work pattern, their constant night, or their bank staff, or etc., or they have something different about them, which makes them a little less likely to speak up, because well, from my experience as a teacher, I'll tell you that having any sort of difference about you makes you kind of vulnerable, makes you feel, oh, how can I speak? I had students with additional learning needs, or those with dyslexia. They'll be hesitant to read because they don't want anyone to be laughing at them because their reading is not very good, or neither do they want their work shown to others because they think the spellings might be wrong. So anyone with sort of even if you go into a room full of young people and you are in your 70s, you are likely to think, well, these young people are not going to listen to me because they will just say, what can this old lady say or this old man say? So they think that they are less likely to, to speak up or to raise their voice because they think that they already, they won't be listened to. So it applies also to various groups within our staff workforce, that some people do feel that they cannot be heard, and so they are seldom heard. And what can we do? We'll again try and suggest methods that we can reach out to all those other groups. But one thing that I've already started doing, we want to make a leaflet. We know we are in the pandemic. Sometimes things such as leaflets and posters don't seem to be very welcome in certain areas of the service, but I'm sure they are appropriate places where we can still have the poster of the Guardian, have some leaflets about speaking up and how to speak up and why it's important. So the posters should be out shortly, and so that night staff, bank staff can just pick a leaflet and read at home. Okay, so we want to encourage all staff to access the Freedom to Speak Up e-learning that was launched for all healthcare workers. It's already on Connect, it's on ESR, but we want to make it mandatory. I have since been waiting, I think it's 2 months now since I asked for the Freedom to Speak Up for all healthcare workers to be mandatory, but I think the process is taking long. We want it to be mandatory, just like safeguarding, so that if everyone knows what Speak Up is about, they are more likely to speak up. They would have done it in their induction as they start the new role, etc. And so that's one of the things that we're doing. Some of the things that the Guardian has done so far to raise visibility, what I've done, as I said earlier, that I took the post in November 2020. So I've had introductory meetings with various stakeholders internally and externally. I'm using every opportunity to be visible within the trust. Although due to the current pandemic situation, this is all done virtually, but I'm joining divisional meetings, team meetings, I'm joining staff networks. I've been on the BME staff network and other staff networks as well. I've been on the Junior Doctors Forum presenting about speaking up. And obviously I have tried to promote recruitment of champions and development of champions, and I'm quite happy now that we have 25 trained champions. So it is ongoing. I'm also joining team meetings with certain teams where they've been identified as kind of hotspots, because there's a lot happening in those services. I've even offered to join their team meetings where I can speak to staff and have more engagement with the staff on the shop floor. So I'm trying, I am trying all I can to be visible, and I'm sure with all the suggestions that you are making, I quite like what Jane suggested as well, which I might include as well in my raising improvement of visibility. Right, okay, so moving on, where we are now. So that graph, pie chart, you can still see, can you? Right, so the graph shows our speaking up or concerns raised by quarter. So far, for the 4 quarters, right? So from quarter 1, which is the one in blue, you can see that there were lots of concerns raised there, 26.31. That would indicate the time when the pandemic started, about April, May, June last year. So there were lots of concerns raised around PPE and, at the start of the pandemic. So there were many, that accounts for the the numbers in the concerns raised in that quarter. And then just an explanation of Q3, because Q3 we had the least number of concerns raised. You would say, why? What was that drop from Q1 and then Q3, the drop? That indicates the period when we didn't have a guardian. As you know, Helen left sometime in August, I think mid-August 2020. Our guardian left, and during that time, I understand that Julie Hankin, the executive in charge of Freedom to Speak Up, was holding the post or taking any concerns. But it was clear during that time that there were almost no concerns raised. I think there were maybe 2, which again indicates that people don't always feel comfortable and confident to speak to higher leadership. So she didn't have many concerns raised through that period. So I started on the 2nd of November, which was towards the end of that Q3. And then Q4, which is the one shown in bright yellow, already we are on 21.25. It's not yet at the end of the quarter. You can see that there's an increase again in speaking up. People are speaking up. They are raising concerns, coming to the Guardian with their concerns. So it is showing that the culture is improving. But again, we could say it can be either or, maybe a good sign, or it might be a sign that sometimes when there is less people speaking up, it might mean that speaking up via the Guardian, it means that maybe they are more comfortable speaking up to their managers. But at the same time, it might be that people are scared. When the numbers go up, it might show that they are not speaking to their managers. It might be, it can indicate all the different things. Anyway, let me not dwell much on that. I will let you decide what you think might be the possible reasons. So a lot of people are speaking up via email. Face-to-face is very a small number, and then telephone, a small number also deciding to speak to the Guardian via telephone. Sometimes people start with email and then they will arrange a face-to-face. So it might be both email and then face-to-face to clarify things. So in terms of the themes, the concerns, what are people speaking about within our trust? So most concerns raised, and this is not only in Nottinghamshire, to be honest, I've checked other trusts as well. Most concerns are around attitudes and behaviours. They are the most number of concerns that we have via the Guardian. Things such as bullying, microaggression, and just general bad staff attitudes. We've got cliques, we've got gossip going, and just bad toxic culture around the organisation, or managers not listening, etc. So we have quite a big number on that. And then the next one is the policies and procedures is also quite high. Mainly, it's not to do with policies themselves and the procedures and processes, it's the application of them. For example, sometimes it's around recruitment, where recruitment maybe wasn't fair, etc., and people are unhappy. People also speak about quality and safety, might be sometimes safety of the patients or their own safety. So quality and safety, even the ones to do with PPE, sometimes they might also fall under safety, or if it's to do with procedures or policies not followed, then there might be policies. So it might be just either or there. Equipment and maintenance, we only had 4, and then services, service changes. So that's how our graph looks like in terms of what sort of concerns people are raising within our trust. Now, I've talked about training earlier, that we have 3 levels of training. We've got Speak Up for Everybody, which is available on ESR for volunteers, students, and everyone else. It's Speak Up for All Healthcare Workers, which was developed by the NGO and NHS England. Right, so and then we have Listen Up for Managers, which also came out on the 26th of January. Now, Listen Up for Managers is very, very important because it trains our managers on how to listen and how to accept feedback and what to do when people speak up, etc. And we are encouraging all managers to take up the Listen Up training, which is available on e-learning for health. And then follow-up for executives is about to come. It's not yet out, but executives and managers have to do all three. So they have to do the speak up for everybody, then they do the listen up, then they have got to do the follow-up, which is, again, will help them know how to make sure that people are listened to, how to follow up, how to ensure that learning happens from what people speak up about. Okay, right, so now we are coming towards the end, and again, I've got 3 questions that I want us to end by looking at together. So from what we have already looked at or learned today, how can we help to create a culture change, a culture where people are not afraid to speak up, to raise their concerns? And also, how can we ensure that seldom heard groups in our workforce can speak up? How can we encourage speaking up amongst those who are not heard more often? And lastly, I want us to think about any ideas for improving visibility. So we'll start one at a time. If you can put in the chat box, please, your thoughts about the first question, the things that you think we could do to create a culture change from how things have been done. Or some of you already know what challenges are within your organization around speaking up. How do you think we could create a culture change? Actually, I want us to, we could easily combine question 1 and question 2, and also about seldom heard groups. How can we ensure that we reach out to them and encourage speaking up? If we can type those 2 first, we talk about them, and then we can end up by talking about ideas for improving visibility. Please put in chat box, and then we'll discuss. Put your ideas in the chat box, and then we'll have time for discussing. So we've got 20 minutes. Actually, we might just for any. It might be for improving visibility, because improving visibility creates a culture change. So just any thoughts you have around those 3 questions, put anything in the chat box, and then we will have time for discussion. I think by so doing, then we'll have time for more talking and ending up well. Yeah. Right. Let me see. So let's see what we already have in the chat box. Yes, Fred, you already had commented rightfully there to say, I think they go together. Improving visibility will improve others. That's true. That's very true. Let me see, anything else I've missed? I've not been checking the chat box much. Let's see, I'll start from the top so I don't miss anything while you are putting your ideas in the chat. Becky, I know where to send my ironing now. Thank you. Right, Nigel's gone. Okay, thank you. Jenny, apologies. Okay. Sure, apologies. Oh, right. Oh, Jenny, that was a good suggestion. You sent it a while ago. I could ask Jordan to come to Champions and get a nice photo for Connect. Okay, if you could let us know where you are based, could get. Did you all see that? That's brilliant. So Jenny could help. If you could email Jenny your workplace, that would be great. Jenny is saying she could ask someone to come to take a good photo of yourself. Yeah, I was thinking we could just use any shoulder kind of size, but that's a good suggestion. Thanks, Jenny. Right, okay, I'll move. We've done protected time. So I'm just starting from the very top because I've not been looking in the chart. Coffee morning with Spock. Okay, Nigel's gone. All right, yeah. Shedding box. All those from last time I had not looked. Yeah, sure. Right, okay. Right, okay. So Deb, you're saying you're surprised that quality and safety was only 14% considering we are in pandemic and PPE. I think what could have happened is it might have, some of them might have appeared as if it's more policy, but I'm recording differently. If something is both policy and quality and safety, I separate it. I indicated on my tracker for both because it will be ticking both boxes. So in terms of your what you've said about you're surprised that quality and safety is only 14% considering the pandemic, it's really true. I'm not sure how Helen was doing, but I am actually plotting both. If it's policy as well as quality and safety, I indicate that on my tracker. Thank you. Right. All right. Oh, you worked with Julie Hankin, Jane. All right, great. Right. Okay. Right. Well, let's get to the questions now. Right. Okay. So, develop positive cultures around speaking up. We need to build a collective guiding leadership around freedom to speak up. So that champions are essential in supporting this process is brilliant. Yes, good point. I think what we could do with the time that we're left with, because the ones that are in the chart, we can always revisit them and come to them. But if people wanted to explain some of the things that they've already put there, we can have a discussion then because we haven't got time. I'm seeing that if I start going one by one on the points raised, that might, take some of our talking together time. So I will stop sharing. I'll stop sharing and then we can have our discussions again around, right, there we go. I think I've managed to stop sharing. Right, okay. Right, so do we have any hands up to explain on any of the things that you have put in there, how we can improve visibility or how we can help create a culture change? Yes, Gail.
I put it on the chat. So after the training that I did, we decided that we put a poster together actually saying who the champions were within Rampton. We've had that placed onto the screen, which is in staff search. So that has all the information on a rolling sort of programme. So as each slide goes round, people can see it and read it as they're going in and getting their keys as they're going into the hospital. Also did a poster of who all the champions was and their emails and had them laminated, sent them to all the wards and all the areas in the hospital and asked them to put it up so that we were visible. As part of my wellbeing team, we do a resource pack that is on all of our wards and all of our departments. So it's a wellbeing and inclusion resource pack. So I've got it on my to-do list to do today, that the Freedom to Speak Up information will also go out today to all the wellbeing champions to put it into them folders as well, because a lot of staff read them actually when they're having the breaks because they're in the staff rooms. So they read them to find information. So it'll be another area for getting it out there. And as of this week, we've included it into our induction. So the slot that my team do on induction, which is about well-being and looking after yourself and having the courage to seek help if you need it. Freedom to speak up is actually going ahead now as we speak. It's the first session today, so it's included into that induction pack.
Excellent. Wow. Excellent ideas. Thank you for sharing that with us, Gail. Yes, I like the idea of electronic notice board. The one that, So
all the information about who people are on it, like, you know, the operationals manager and matrons and everything is on it. But there's a separate slide on now that is the Freedom to Speak Up champions within the hospital. It's also got your mugshot on it as well, Simbi, so they know who the head of it is if they want to contact you. And then it's got the rest of us around it. But I'll send you it electronically through to your email.
Excellent. Wow. Thank you. That's great. I think it's something that we can also do, can't we? Could we not ask within our organization so that people can just see the face? If you have your photo there, Freedom to Speak Up champion, and then you can have the guardians as well. The guardian poster is there. I could email all of you could have the guardians poster, so that if you have yours, if there are 2 or 3 champions within your service, or you're just the only one, we could have the guardian and then the champion on there. It would be good. And then the hashtag speak up to me or whatever. That's brilliant. Wow. Thank you. Any other hand? I'm not seeing other hand. 2 other hands. Who is that one? Jane. Go on, Jane. I don't know.
What I was going to say is about the sports round proposal. The money and the funding. When I worked with Gail, we had a proposal about doing sports rounds, and it's about eradicating cultures, and it's like looking at getting guest speakers in once a quarter. And it's from chief exec down to the gardeners. No discipline is, nobody's discriminated against. And it's a really, really fantastic piece of work. I work with Julie on, with our head of psychology at Rampton, Lawrence Jones, because if there was anything that came up, there was somebody there who could do like a debrief after it as well. So I'm just really giving you a snapshot about it, but I'm happy to share it with everybody to see what they think. But the money's there. It was there, and then COVID hit, and it's all been signed off by the board. So it's just about now people having an understanding of what it is and getting it up and going, really, which is something I don't know if I'll be able to do in my new role, but I'm sure Gail would be able to keep it going, Gail.
Yeah. Please, if you can share, Jane, that would be great.
It's because obviously I haven't got I'll just 1 minute. I'm just trying to. I'm not very good at this, so just try and bear with me 1 minute. I don't know how to. What I'm going to try and do is, I don't know. I'm just going to try and share it with you all, but I don't have all your emails from how to share it electronically.
Do you want to share it with me? Then I'll send to everyone.
Oh, that'd be great.
Yeah, it would save. Yeah, then I can send to all the champions. Yeah, that would be great. Right. Thanks, Jane. Becky, you had your hand up.
I think I'm really interested in sort of how we the cultural side and the cultural element of it, because I'm sort of aware that in terms of culture, it'll eat strategy for breakfast if we don't get that sort of plan in place first. And I think culture is such a powerful thing, but is also quite a complex thing. And so from my point of view, it's sort of thinking about how some of the stuff that we've already spoke about now, like the groundwork that sort of needs to be met around making sure that we have a collective of Freedom to Speak Up champions that not only are from sort of different backgrounds, but also I think different areas as well, because it's really important that we have a collective that understands the microcultures within different teams and different services as well. I think personally that if I was wanting to go and speak to somebody and sort of make myself vulnerable to speak to somebody, it would be really helpful if I felt that they understood my working position and what was going on around me. What I think is also important as well, though, as part of the process, is that ensuring that there's that joined up feedback loop as well. So again, if I was a staff member and I was investing in this process and sort of, really wanting to become motivated and be part of that service, is how do we get that feedback back to staff members across the service? Sort of, I think I put it in the chat, something like, maybe, I don't know how suitable it is, but maybe even a newsletter, something like you said, we did, so that, and it doesn't have to be like that, but that's just an example. But like, if they collectively, if we're getting themes that are reported to us, how is that information being transparent again back to them? Because I think it's that transparency that really helps us develop that positive culture. And so for me, feedback is an important element as well. And then the rest of the time, I'm just listening to all these wonderful ideas and thinking, I've got to start doing some of this stuff. But yeah, that's just my thoughts anyway.
Yeah, well, that's the whole purpose of this forum, so that we can learn from each other and start doing some of this stuff. Thank you. Yes, in terms of learning at the moment, yes, definitely we are trying to take some learning, but it's important to think about how the learning is spread across and to say, since we're getting these themes, so what are we doing? But obviously work is going into the, sort of like the areas where certain themes have come from. And if it's something that has been raised that is affecting the whole team, and all these reviews that are going, and feedback will go back to people or to the person who has raised the concern to say 1, 2, 3, 4 things have happened or have taken place to try and address that culture. Are you happy with the progress so far? So my role as guardian is to keep feeding back to, especially if it's a concern that has been raised by someone, to go back to them and give them the feedback of what is happening to try and address that. But certainly as an organization, as a trust, it's about learning from those and saying, I really like what you said as well about newsletter, kind of, what's going on. Some of the things we might have to just generalize, because obviously when people speak up and raise concern, it's sensitive to them, and sometimes they don't always want to be identified that they're the ones who raise this. So depending on what it is, it's good to just highlight.
Just trying to think that at the minute, we probably have a minority of staff that will use the freedom to speak up process. However, I know from having worked in this trust for 11 years that often if you speak, and also being in a managerial role, often a lot of people may have those similar concerns, but they haven't addressed the freedom to speak up process. So for me, it was, I know we have to be really careful about feedback and absolutely protect confidentiality, but for me, it was about thinking how we could raise the profile and increase the level of learning for all staff, because a majority of those staff are the ones that haven't used the freedom to speak up process, but by maybe having access to a newsletter or something similar, they can then go, oh my gosh, that's what I was worried about, and this is what's happened. And it sort of helps to unveil the process a little bit and helps them to learn that actually this and this could have been done as a result of that, and might just make the process a little less daunting in future. I don't know. It's there's a whole cultural theme around the freedom to speak up process in itself, isn't there?
Yes,
it sort of needs addressing, and it can only work via education, can't it? Really, and learning and a different experience, I suppose. But anyway, I'm going on.
No, that's fine, Becky, thank you. And Debbie, you've also put that it's interesting that because they've been told that any concerns they should just report to their respective agencies. If so, how do we change that? Does anyone want to answer that before how do we change that if people have been told that they should report maybe to their union or to their Well, I think that's exactly what we're talking about today, making ourselves visible and making sure that people know about the different alternatives for speaking up, that if they don't feel comfortable speaking to their manager, they can speak to you as a champion. They can also speak to the Guardian, just raising awareness, which is one of our main roles as champion, to raise awareness about speaking up, and also dispel all that misinformation that people might have about speaking up, and just giving them the reassurance that it's okay to speak up. And then if they speak up and they start to suffer detriment, again, be there to support them, be there to raise this up, speak to me, speak to, we need to take the procedures to make sure they are protected and that they are not suffering any detriment as a result of their speaking up. Thank you for the comments that are in the chat. And I also had I had a few that I had thought about. Probably we might have mentioned these in the chat. I haven't had time to read all of them, but I also had things like email signatures. I don't know how many of you guys as champions, you have put something about freedom to speak up on your signature. If you want me to send you some of the few ideas that I have, I can do, but also the National Guardian's website is a good one to go. I can send you the hashtag Speak Up to Me. I can send you, I've got another one as well about speaking up. I can see some yes, please. I will send you signatures so that you can put that speak up to me thing. So we've also said about, making sure that we can be put on the electronic notice board if possible in our places. Certainly making sure that the Guardian's poster is displayed in your workplace, very important. The other thing I had as well is lanyards. I don't know what you guys think, but I think when the pandemic is over, we need to wear our Freedom to Speak Up lanyard. Yes, you can still have your badge about your role as a physiotherapist or whatever, but if you have the Freedom to Speak Up lanyard, that would be great. I've already written to the National Guardian's office. They've said they are not making them at the moment due to the pandemic, but they've sent me a PDF, which I've sent to the comms department to try and see if they can make for us the lanyards. They will be green. They will be talking about speak up. So lanyards, I've got those in trying to sort those for you guys and making sure when they are ready, they can be delivered to your places. Again, having our names and list on Connect increases visibility. We've said today about Let's Talk Time, about coffee mornings, etc. The one that I was saying earlier before we went for a short break, it was about making Freedom to Speak Up a standing item. I don't know how that will go as an organization, but I'm suggesting it to say, why don't we have it as a standing agenda item so that anyone who wants to say something around speaking up can say. It might be just like safeguarding it. People would just say nothing, no concerns. But if it's there during our supervision, if you've got anything around speaking up, then we have a chance to speak to our managers about things that might be concerning to us. So I really think that would also help. Yep, so we almost coming to an end. So let me see if there's any burning point that might be in the chat. Anyone, if you see anything that someone has put there that I haven't addressed or you think it's worth hearing it together, we've got 1 minute. Anyone who's final thoughts? On my slides, I had just put there anything you are taking away from today, any comments, feedback about today's, anyone who would like to say something. But from me, I really just want to thank everyone for your contributions. This has been really useful forum, and I've obviously learned a lot, and it's been quite a good development. I'm sure, we all had something to take. Any final comments, final thoughts from anyone, please, before we finish? I'm not seeing any hand up. If I'm missing anyone, but yeah, go on. Can you hear someone wants to say something? Jenny.
Yes, I would. Sorry, I just wanted to say thanks for the session. It's been really good and really interesting. And just to share, because in the background I've been creating the whiteboard. So I'll just share what we've got on there.
Fantastic.
Can you see that? So I can, there are lots of things that go across each of, go across all of them really. The bits in the middle go across every single bit really. But yeah, just to capture any on there. And if you want to have any more that you want to put onto there, you can circulate it, Simbi, with the and the recording gives you a record of what was said as well. So so if you want to circulate it, and then people can add to it, and we could use that to build a sort of a roadmap really.
Fantastic. That's brilliant. So you mean circulating this the whiteboard, isn't it? Yeah. After the meeting. Yeah. Brilliant. Thank you. It's beautiful. Wow. We're lucky to have people with technological knowledge. Yes. Thank you, Jenny, for that's brilliant. I really appreciate it. Great stuff. Yes. People are commenting there and everyone's so pleased. Yes. Thank you. Right. So we've come to the end. Looks like I'm sad that that I've got to say goodbye, but it's been lovely. And again, I just want to say, anytime you want to have time to chat with me, I'm available. Feel free. Obviously, the reporting form is there, but it's not to deter you from having contact. We can meet up as and when. Oh, that reminds me of a very important thing I had here. How frequent do we want these sessions? I know that from the previous Guardian, I think you were meeting twice a year. Do we want that, or do we want more often? So far, we met on the 8th of December, and now we're meeting the 8th of March. I was thinking every 3 months, which means 4 times a year. What do you think? Would that be too much?
No, I think every quarter would be fine.
Yeah. Every quarter, yes. So we'll meet once a quarter. And what I will do as well, I will ask Nicola to help us send the calendar dates in time so that it's all booked throughout the quarter. I must apologize that this time I think you were given less than a month's notice. So again, thank you so much for committing to it. It was just, planning and lots of other things. As you know, when you're in a new role, things can be haphazard, but I'm just so grateful that I've got a strong team of champions, to work with, and together I'm sure we will, we'll get somewhere. We'll get somewhere far. Thank you again for today's ideas. Sharon, did you want to say anything today? I don't think we had you. Did you want any final thoughts, remarks? Sharon.
Do you mean me?
Yeah. Yes, I mean you, Sharon. I'll put you on the spotlight.
No, that's fine. No, it's been a really good meeting, actually. Even I've, listening to what people have been saying, even I thought, I never thought about doing that. So, even now I'm writing emails saying, let's do this, let's do that. And I'm just thinking about Fred. I think we need to get together and find out who the Freedom to Speak Up champions are in MESOP and start using some of these ideas. I think it's been a really good meeting. Yeah, I've learned a lot today, actually. It's been excellent.
Oh, thank you. Thank you very much. Yeah, it's just that we've run out of time. I was going to suggest another about a WhatsApp group, because we did with our East Midlands Guardians network. We've got a WhatsApp group so that if someone wants to post, you just say, I've done this, or what you think. Obviously, we know our professional boundaries around use of WhatsApp, but some people are starting to use the WhatsApp, and people just share ideas continuously around that. But we can leave that for our next day session. For now, maybe we can just use our Teams if anyone wants to post anything there. And I think this recording will go on there as well. And other resources that I'll be putting on there, the bulletins, I'll forward you the quarterly bulletins from the NGO so that you might get ideas in there about what to do with your teams as well. Sorry, it looks like time is really has not been enough, but it's been wonderful. I think we can end here. Thanks again, Jenny. I think we can stop recording now. Thank you and goodbye.
Thank you.
Thank you. Bye. Thank you. Bye. Bye, everyone. Bye. Bye.